Fibrous cords which connect the free valve margins and ventricular surfaces of the valve cups to papillary muscles and ventricular valves. Option A, chordate tendineae. Option B, bundle of his. Option C, lunulae. Option D, Kent bundles. The answer is chordate tendineae. The chordate tendineae connect the tricuspid valve and mitral valve to papillary muscles. Multiple chordate tendineae attach to each leaflet or cusp of the valves. Cardiac troponin T or cardiac troponin I is a protein marker in the detection of option A, myocardial infarction, option B, congestive heart failure or congestive cardiac failure, option C, ventricular tachycardia, option D, atrial fibrillation. The answer is myocardial infarction. Troponin is a regulatory protein found in skeletal and myocardial muscle. Troponin T and troponin I level elevate 3 hours after myocardial infarction. What must the nurse do to determine pulse pressure? Option A, multiply heart rate by stroke volume. Option B, subtract the diastolic from the systolic BP value. Option C, determine the mean blood pressure by averaging by 2. Option D, calculate the difference between apical and radial pulse rate. The answer is subtract diastolic from the systolic BP value. Pulse pressure is the difference between systolic and diastolic blood pressure. It represents the force that the heart generates each time it contracts. What complication should a nurse assess in a newborn after precipitate labor? Option A, brachial palsy. Option B, fractured clavicle. Option C, dislocated hip. Option D, intracranial hemorrhage. Answer is intracranial hemorrhage. Precipitate labor is when a labor is very quick and short, and the baby is born less than 3 hours after the start of contraction. Intracranial hemorrhage resulting from a sudden change in the pressure on the fetal head during rapid expulsion. A nurse anticipates that newborn of diabetic mother often have tremors, periods of apnea, cyanosis, and poor sucking ability. These signs are associated with option A, hypoglycemia, option B, central nervous system edema, option C, hypercalcemia, option D, congenital depression of islets of Langerhans. The answer is hypoglycemia. Symptoms of newborn with hypoglycemia: hypothermia, irritability, pallor, tremors, weak or high-pitched cry, lethargy, hypotonia, generalized seizures, coma, cyanosis, apnea, rapid and irregular respirations, diaphoresis, eye rolling, refusal to feed, hunger. A patient is prescribed prolonged bed rest after surgery. Which complication should the nurse prevent by teaching the patient to avoid pressure on popliteal space? Option A, cerebral embolism. Option B, pulmonary embolism. Option C, dry gangrene of limb. Option D, coronary vessel occlusion. The answer is option B, pulmonary embolism. Pulmonary embolism is a condition in which one or more arteries in the lung become blocked by a blood clot. Symptoms of pulmonary embolism: sudden shortness of breath, chest pain, feeling of anxiety, feeling of dizziness, palpitation, coughing or coughing of blood, sweating, low blood pressure. Thoracic endovascular aneurysm repair is a dash procedure. Option A, surgical. Option B, invasive. Option C, interventional. Option D, non-invasive. The answer is option C, interventional. The thoracic endovascular aortic or aneurysm repair procedure involves the placement of a covered stent into the weakened area of the artery. This provides a route for the blood to flow without pooling in the aneurysm. Which of the undermentioned chest compression rate to 2015 CPR guidelines? Option A, 100 to 125 per minute. Option B, 100 per minute. Option C, 110 to 125 per minute. Option D, 100 to 120 per minute. The answer is option D, 100 to 120 compression per minute. As per American Heart Association 2015 CPR guidelines, the chest compression rate is 100 to 120 compression per minute.